My name is Biswalo Yango. I am a COSECSA fellowship trainee. I'm a Tanzanian, but I am training in Ethiopia, Addis Ababa. When I finished my master's in general surgery, I had a clear goal of wanting to be a plastic surgeon. But then at the moment, we did not have any training center in Tanzania. So it's a good thing that COSECSA is here, because through COSECSA I was able to find a training center outside Ethiopia, outside Tanzania. So I was able to pursue my study in Ethiopia, and currently I'm in my final year of my study. The college is affiliated with many hospitals in many countries. Therefore, through COSECSA, you can go to another hospital that is also accredited with COSECSA, and for a certain time, and you can learn there. I became acquainted with COSECSA when I was looking for centers that I can study plastic surgery, and since there was none in Tanzania, so I kept on asking my friends, and they linked me to people who have done programs under COSECSA, and at last I got one who had finished plastic surgery, and then she made sure I understand the COSECSA program, how it works, and the centers that they have across the region. And after that, I started my application. And so initially I made an application to the headquarters, and then they give me a document, and then through the same COSECSA connections, I was able to get connected to one of the plastic surgeons in Ethiopia, whom I emailed, and he replied to me as a confirmation that I can join their center, which I attached that letter to COSECSA, and I got a chance to join there. The experience so far is good. First, you get a chance to choose a center that you want based on what you have in your mind, based on what you want to achieve. Maybe some centers they have more patients of reconstruction of a certain disease. So if that is what you want, then you can choose those, and we get a chance to have a good contact with our supervisors. In most cases, it's maybe daily encounters with the supervisors, and then COSECSA has simplified learning by creating a platform of which we have standardized educational materials, like they go across our curriculum. So it also, despite the fact that different centers has different specialists, but then they have made sure they standardize the education so that someone who is studying in Uganda, let's say, can have the same knowledge with another person studying in Ethiopia. I think the workshops that adds other things apart from the surgery knowledge, I think those ones are the career changing, because all of the trainees, they acquire the surgical knowledge at their centers, at least most of it. But then it's not all the trainees that get exposed to research methodology and the likes. And for example, in the past week, we have had also clinical life skills, things like humanitarian in medicine, conflict resolution, communication skills. However subtle that they might seem, but they improve someone's career as a person. And well, the world now is going to evidence medicine, so things like research they add a value to a doctor. Like, not only you know how to cut, but also you can do some research and come with some facts. Plastic surgery, it's a fascinating subspecialty because it's life-changing. Someone walks in the theater with a certain deformity or with a certain body condition, and then they come out with a good function of the body, or otherwise they might even be looking different. So a lot of things can fascinate you in plastic surgery, but the area that fascinates me most is hand surgery and somehow pediatric plastic surgery. First, it's an evidence-based approach, and they also set goals for you. So it's not like just a walk-in and after a certain time you get your degree. So they have created a system such your mentor will be able to follow up on you through the logs and through the daily meetings, and even the headquarters can make a follow-up on you through the topics in the modules that you finish, through your logbook. So there is a good system for follow-up, and also regular check-in through our mentors. They also help a lot. So then at the end of the day, you get a good knowledge. I think it happens every day. I think it happens almost every day, like in daily life. I can recall one of the days, again, I was on call, and then I was called to the ward with a patient who has developed a complication. He was just few hours post-surgery, and then because the patient was in great pain and or whatnot, and the patient was bleeding, so immediately I knew I needed to take the patient to theater. It was late at night. It was around 9 going to 10 p.m. But then when I went to the theater to book for the operating room, and also to inform the anesthesia team and the theater team that I'll be coming with the patient, I met Dr. Abraham. For some reason, he was still there at the theater. So then I brought in my patient. When I was on the operating table, even before I went to him to tell him, now the patient I consulted you about is on the operating table. He came himself on the table, and we had quite a discussion, and I was able to tend to that patient. I'm not sure if I would have done the same decisions if I didn't consult, or maybe if he was not around. So that is one moment I can mention, but there's been quite some moments. Through this opportunity, I and other people who would be interested to pursue this, then they can get a chance. But again, COSECSA has journal, and it has different trainings on research. So one gets a platform to publish the scientific studies, but as well they get a chance to improve on research. So through these, then I believe I can keep on improving myself using the COSECSA platforms. When people hear about COSECSA, they think maybe there is a very bureaucratic application process. So the application process is very straightforward, one, and the other thing is one might also think because they are not in the university program, then maybe they will not be getting the knowledge that they want to acquire. But COSECSA has a very good curriculum, and it's standardized, it's more or less the same as the one in the university programs. Also, COSECSA can give you a privilege of staying in your home country if you have hospitals which are accredited by COSECSA. So there is nothing tedious about the application process. The knowledge is good, and one cannot even believe that we are studying free of charge. So I would advise them to proceed, do an application, and get enrolled in the programs. It's a good place. 25 years, quarter century. I think it comes with a great awareness, because I believe over time there's been an increased number of applicants, and maybe what I would want to say to the community is, one, they should appreciate the engagement of COSECSA in increasing number of doctors, and also, if there is anything that community needs to support, is to support the education system of doctors of all cadres, so that at least we can combat the problem of insufficiency of number of medical doctors for the 25 years anniversary.